We will talk about scientifically backed methods to lose belly fat, why belly fat is a problem beyond cosmetic concerns, why it develops so easily and is so difficult to remove, and how to prevent it from coming back. When we talk about belly fat, we usually refer to the fat inside the abdomen, around internal organs, which causes a protruding abdomen. This is called visceral fat. Another type of fat is subcutaneous fat, which is the fat under the skin that you can pinch. Now let's discuss how to reduce belly fat and avoid its formation. The main issue with belly fat is that it is metabolically active. This means these fat cells constantly release inflammatory mediators, small molecules that cause tissue damage in the body and lead to a state of chronic low-level inflammation, which over time becomes a serious problem. This ongoing inflammation contributes to insulin resistance, diabetes, and heart and blood vessel diseases. In addition, this fat is deposited into the liver, leading to fatty liver, which can progress to fibrosis, cirrhosis, and ultimately liver failure. Similar processes can occur in the pancreas, muscles, and even the heart. In real life, the more abdominal fat a person has, the greater their risk of developing diabetes, heart disease, and even cancer. Excess abdominal fat significantly increases the risk of cancers, particularly colorectal and breast cancer. People with significant excess abdominal fat tend to live 8-10 years less compared to the general population. Excess abdominal fat is defined as a waist circumference of more than 40 inches, 102 cm for men, and more than 35 inches, 88 km for women. For Asians, these norms are lower. Generally, a smaller waist circumference is better if the person is otherwise healthy. To measure your waistline correctly, use a tape measure at the narrowest part of your belly, usually just above the belly button level. The first way to reduce belly fat is to eat foods containing soluble fiber. Such foods include oats, flaxseeds, avocados, beans, lentils, apples, and oranges. Soluble fiber slows down the movement of food through the digestive tract, leading to a slow absorption of nutrients and a gradual release of glucose and insulin into the blood. Lower insulin levels cause less fat deposition and more fat burning in the belly. There's also evidence that every 10 grams of soluble fiber consumed daily reduces visceral fat over time, independent of other dietary and lifestyle factors. Additionally, soluble fiber binds to cholesterol and excretes it in the stool instead of allowing absorption, thus reducing cholesterol levels. Among the mentioned foods, oats contain the highest level of soluble fiber, around 3.5 grams per 100 grams, while apples contain around 1.2 grams, with the others falling in between. The second method is high-intensity interval training. The exercise form, where short bursts of intense exercise are followed by brief recovery periods, is particularly effective at burning visceral fat. For example, sprinting for 30 seconds followed by 2-4 minutes of walking, then sprinting again, repeating this cycle 10-12 times. Other types of exercise, such as bodyweight exercises in interval cycling or weightlifting, can also be effective. The main idea is to alternate heart rate between near maximum intensity and less intense efforts. The primary benefit of this exercise is that it significantly accelerates calorie burning, both during and after exercise due to the afterburn effect. The intensity of HIIT helps mobilize fat stores, and because visceral fat is metabolically active, it responds well to this kind of training. HIIT targets fat more effectively than moderate intensity continuous training and also significantly improves insulin sensitivity. HIIT is almost 3 times as effective and burns more calories than continuous moderate intensity training. The third way is to increase your intake of polyphenols. Foods containing polyphenols significantly reduce belly fat. These foods include green tea, berries such as blueberries and blackberries which contain anthocyanins, dark chocolate which contains flavonols, and red wine which contains resveratrol. Foods rich in polyphenols have strong antioxidant activity and downregulate the genes that cause inflammation and fat deposition in the abdomen. They also activate enzymes involved in the breakdown of abdominal fat, meaning polyphenols accelerate lipolysis. For example, polyphenols from green tea, particularly epigallocatechin gallate H, have been shown to increase fat oxidation and reduce abdominal fat in obese individuals. Additionally, polyphenols positively influence the gut microbiome by promoting the growth of beneficial bacteria. These bacteria can produce short-chain fatty acids, SCSCs, that improve fat metabolism and reduce fat storage in the abdominal area. Fourth method is practicing intermittent fasting, which helps reduce abdominal fat because during fasting, insulin levels decrease significantly. Instead of storing glucose as fat, the body begins to burn fat, particularly from the visceral region. Intermittent fasting also boosts levels of norepinephrine, a hormone that enhances fat breakdown lipolysis, and increases the secretion of growth hormone, which helps maintain lean muscle mass while promoting fat loss. The 16-8 method is the most popular form of intermittent fasting, where there's an 8-hour eating window followed by a 16-hour fasting period. This approach significantly reduces belly fat, especially if overall calorie intake is reduced. The fifth method is to avoid large meals. Even if you don't gain weight, eating large meals causes spikes in glucose and insulin levels. High insulin levels preferentially cause fat storage in the abdomen. Some individuals may maintain a stable weight but experience an increase in visceral fat due to the body's tendency to store excess energy in this area, often correlated with large meals. A meal over 700 calories is usually considered large, especially if the food is high in refined carbohydrates and sugars, such as fast food and processed foods. For example, 1 cup of cooked oatmeal can weigh the same as 2 slices of pizza, but oatmeal is healthy with under 200 calories, while the pizza, being refined carbohydrates, contains around 700 calories. In this case, it would be considered a large meal.